Hello, I'm Sally Amos.
And I'm Emma Taylor, and we work for the Health Promoting Schools team in Monmouthshire. There has been a long-standing relationship between these two networks since SHRN was first developed. In Monmouthshire, we support schools in a variety of ways, including on an individual school basis and during our regular cluster meetings, when we regularly reference the survey and its purpose as part of these discussions. Your local Health Promoting Schools team will be encouraging your school to register and participate in the pupil survey and school environment questionnaire.
Participation with the SHRN survey has many benefits. Overall, it provides an insight into the health behaviours of children and young people. Many of the themes within the survey relate to behaviours out of school hours, but learning is key and messages can be designed around these themes which support overall health promotion. Using this data, we can gain an understanding, identify areas of strength and areas for development, action plan, strengthen cluster working, develop the curriculum, policies and wider messages for families and the community. An example. Last summer we analysed a Monmouthshire secondary SHRN report and identified online behaviours as an area for development. The cluster of primary school wellbeing leads described an increase in the number of issues arising from social media platforms and online gaming. The evidence of this was in the SHRN data, but it was also being observed very clearly in the classroom and in the playground. As a result of this, the cluster develops a letter for families. The letter provided guidance and signposting, but also identified the responsibility of families, learners themselves, and of the school. The letter was widely shared within families and many schools developed lessons around the theme of online behaviours. Schools then provided more targeted interventions for those who were struggling with their emotions and behaviour due to harmful online content. Schools reported noticeable improvement in learner behaviour and families demonstrated an increased awareness and engagement with the digital wellbeing practices. Another example of using secondary SHRN data was where we identified that physical activity outside of school had declined, particularly in girls. The cluster recognised that young people were more sedentary. This was also reflected in SHRN data. The cluster decided to work with local sports development officers to provide families and young people with a list of clubs and opportunities and activities locally. These lists were shared with families and a wide range of activities were promoted. This led to our clusters also developing some friendly cluster sports games in school time and after school. The outcome of this work was that the cluster planned an annual opportunity for physical activities collaboratively, and even the local sports development officer fed back that he had an increased level of engagement with schools. This is an example of how actions driven by the SHRN report can support wider partner involvement. Increased learner participation in physical activities across the cluster, strengthened partnerships with local sports providers, enhanced community engagement and access to opportunities.
King Henry VIII 3-19 school, like many secondary schools across Wales, has participated in SHRN from the beginning. Over this time, the school has really developed how it uses the data, not only to inform curriculum development and whole school strategic action, but also in how the school communicates the data with key stakeholders. The school has used the SHRN data as a catalyst to review the school's anti-bullying policy, prevention approaches, and support systems for students. The school also shares highlights from the survey with families. This includes some of the actions that the school are developing over the coming terms, an example of which can be seen on the left of the slide. Families also receive letters that include signposting or advice to support their children at home and to support the work that the school is undertaking. Chapter School have participated in SHRN for a number of years and have been able to track their data to identify trends and monitor impact using a RAG rating system. The data from the last 3 SHRN reports shows a significant movement in nearly all areas from amber and red to green. The school uses the data to review and develop their health and wellbeing curriculum and broader wellbeing strategies. For example, the school has developed targeted lessons on sleep hygiene, the impact of screen time, and healthy digital habits for students. This information has also been included to families to support their children at home on setting boundaries around devices and sleep routines. The school's strategic focus prioritised developing positive relationship between pupils and between staff and pupils. This included a review of form time and professional learning for staff on active listening and trauma-informed approaches. Developing the relationships with local partner agencies has not only enhanced the school's curriculum provision, but also improved signposting of support for student wellbeing. These changes reflect the school's ongoing commitment to student wellbeing. The school's termly student surveys show a positive increase in happiness, feeling safe, and confidence. In the local authority, we also value the data. We encourage our schools to participate, but we use the data to inform decision-making and to work collaboratively with schools and wider partners through our Partnership Wellbeing in Schools group. After analysis of our previous primary school data, we focused on transition from primary to secondary school. 3 task and finish groups were established, and working together collaboratively, they created these effective practice guides, which we have disseminated to all our early years and school settings in order to help improve the practice of transition. We also work with our local school health nursing team to introduce a C-card scheme for older students. This is a scheme that provides young people with quick, easy and confidential access to free condoms and sexual health information. We have 2 priorities that we're currently working on. One is focusing on secondary age pupils breakfast clubs, and the other one, information for families on children experiencing anxiety.
Thank you for the opportunity to present to you today. We encourage you to find out what's going on in your local authority. Get in touch with your cluster of primary schools and contact your local health promoting schools team. Diolch yn fawr.